All right, welcome back, everybody, to part 3 of our K9 Audiology series of these podcasts with Dr. Peter Skip Scheifele, Fetch Lab University of Cincinnati, and Allison Black Cornelius, CEO of Greater Birmingham Humane Society. Again, thank you all for coming on for part 3. So this will kind of be our tying up of everything for episodes 1 and 2. We're going to be going through some questions and open discussion. So this is really going to be kind of an open floor with everything we've learned and heard from Dr. Skip in the first 2 episodes, and asking, what has been thought provoking for us from the past 2 episodes. And then again, even after this, when audience members hear our questions and comments and conversations, even if our listeners do have questions after the series wraps up, email, DM, comment, anything. We're always open. The door is always open for concerns or questions for your specific needs, no matter if it's dogs, cats, you name it. All of us want to help. So that being said, I guess we'll go ahead and hop right into it with some questions that myself, a couple colleagues, including Dr. Kyle Travis, put together here, just thinking through some questions for Dr. Skip. So Dr. Skip, these are going to kind of be tailored towards the military working dog and canine community, like we just mentioned. First one being noise-induced canine TBI. Throughout your career and studying, the effects of exposure of significant dBs and hertzes for these working canines, have you seen anything related to TBIs or trauma from that noise exposure for canines?
Yeah, we've seen some in the military working dogs, that especially dogs that have gone over to theater, that manifests itself in ways like hyperacusis, which is where the it's like the day after a really bad hangover, where people talk to you in a normal tone of voice and everything seems to be inordinately loud to you. Also, and sometimes that will lead to auditory hallucinations. We see this in some of the PTSD dogs, if they've have had, because you have to remember that whether it's an impulse or an impact noise, whether it is just intermittent noise, the fact is that there is an effect that is a sensory neural effect that is happening to the dog, just like it happens to the soldiers. In fact, we were proponents a long time ago of saying, if you have people that come back, military people, and they have PTSD, and the dog is showing PTSD, used to be the dog got separated from the handler and they were in 2 different places or whatever, but we're more of a proponent now of treating them both together because they have gone through the same thing together. And the chances are that the dog will respond and the handler will respond, or vice versa. But the thing to remember is noise is sensory neural. Noise-induced hearing loss is sensory neural. So you know, the, the sensory systems that we have and that a canine has are going to be impacted, whether it's the peripheral nervous system or whether it's the central nervous system. There will be an impact to that. And the outcome of it is probably going to be something like TBI, different kinds of sensation losses, behavioral. A lot of times what we'll see is we see this in sometimes in zoos and aquaria, where if you got, bands playing, or, you're in a big conference room and it's a big party or wedding or bar mitzvah or whatever like that, one of the first things you see is the animals go off their food. So now now you have a dietary issue, which will probably relieve itself. Point is, you are going to see some behavioral responses.
Exactly. And that kind of leads us into the topic for our next question. So acute versus chronic on those performances from, again, LE or military working dogs. So acute being kind of happens in them within a day or two or three. You're seeing the results of an explosion, being exposed to breaching charge, whatever that case is. You're seeing that acute response. Dog is confused or presenting PTSD in that moment, versus chronic, which to me would be event after event after event of years of exposure. And now at age 6, 7, 8, that dog's career is cut short because of a chronic issue with its hearing causing TBI, PTSD, things like that. So what do we see? Is there any defining moments within a week or two of, again, from a blast or an event, talking from performance drop, acute versus chronic? Are we typically seeing dogs getting pulled off of their careers from an acute exposure, or are we mainly seeing dogs have these issues from a chronic sense when they're 6, 7, 8, 9 years old? Is that when it's really taking place? Is this issue rearing its head at that point, or mainly after immediate events?
That's a really good question, and it goes back to something that I think that I mentioned last time. So every animal, including humans, has a hearing threshold, and it tells us that at any particular frequency, uh, the required intensity to just detect that sound versus becoming louder, to the point where you're at the threshold of pain or even the threshold of feeling, um, is going to be, it's not as, it's not a law. Okay. It's an individual kind of a thing. So I think one of the things that I use is, or I typically use with my audiology students is, if you've ever been to, a, a concert, let's say, not to show my age or anything, but for me, Jimi Hendrix was a great thing. But you came out of the concert, and and so maybe you have three people that all went together. They come out, and your ears are feeling a little full, and you know, but then one person is going to recover, in an hour. Another person is going to take a whole another day to recover. It's an individualized kind of thing. But the one thing you can say is, if you're doing that, if a dog is going out and being subjected this day, and then, a month later, this day, a week later, this day, every time that you move that threshold, that hearing threshold, what's happening is you're getting a temporary threshold shift, which means you've done some damage to the ear. If you keep on doing that, that damage is going to add up. And one day you're going to get a permanent threshold shift, and you will never hear those sounds again in your lifetime. So can it happen? And this is one of the things about it. We're replacing dogs because they can no longer perform well based on the fact that they're not hearing as well as they do. That's just like taking an aged dog of 14 or 15 and sticking it in there, because it's not going to perform the same. And ultimately, that permanent threshold shift will catch up with it, and the dog will have to be replaced. It's
Right.
individualized.
100%. So that's where it's important. No matter, even if there's no issues presenting themselves from an acute standpoint, you should never assume that, oh, the dog's fine. Oh, the dog's fine. It seems fine. It seems, when in reality, you're adding a backlog of issue or event after event after event, that if without the proper procedures or the proper protection in place on the range, on mission, whatever you're doing with those live DBs, you're just risking that dog get pulled off eventually at some
Right.
point.
And so the key here is vigilance. The handlers need to learn the symptoms. They need to know their dog so well that they can get the systems. And this is what I said before. People, uh, pet owners, they don't worry about it, and they don't know the symptoms of the dog is starting not to hear. And by the time they come to me and say, can you test this dog? Can I get a hearing aid on you? Then I'm forced to say, amplification is not going to help this dog, because the symptoms have been going on for too long, and you don't know. Vigilance is everything.
Right. And that's where for any groups or units that can, within their meetings, do a yearly test on their dogs if they're always exposing their dogs to, and we didn't even mention this, but loud kennel environments. Again, going on mission, gunfire ranges. You want to get
Yeah.
that base level and test where you should really begin that base level 1.5 years old before it's been in deep in its career to establish the base. And then year by year by year, make sure you're doing your doing your proper protection and staying vigilant, and that the hearing threshold staying intact and it's not changing.
In a household, situation for a pet, you know, and I'm not condoning not being vigilant, but I'm just saying, that there's not a lot riding on that. But if you're a platoon of people that are going into a serious situation, whether it's police or whether it's, the military, and you are dependent on that dog, that's not the dog that you want to have that can't hear, categorically, because now there's a whole lot more at stake than that. And also what you're bringing up. So if we're talking about temporary threshold shift, if you're putting the dog in a kennel that's, 110 dB, SPL or whatever, he's already got a temporary threshold shift when you come in and take him out to go down to the firing range. So, how many times do you want to do that before he reaches that permanent threshold? And now you got to replace him. And if you're not vigilant, you'll never know.
100%. Absolutely. And no, I agree with you. It all depends on the setting, whether you're a pet owner, working dog owner, LE military, your missions, environment, living situation, everything's different, dog to dog to dog, animal to animal. It's never going to be the same. But the science is the science. That's never going to change. So you should always apply that to whatever you're doing and take that in consideration. And on that too. So even, let's say I have a dog to where, we're doing 3 or 4 breach-ins a week. It's a very busy unit, what have you. And I'm doing my best in training to work this dog up for these events. Let's talk about overpressure or blast pressure having an effect on its hearing, and not just hearing, but cognitively as well. So muzzle blast, if I'm shooting the dog is 3 feet, because some of these dogs like to get worked up and they push past your hip, they push past your waistline a little bit in front of you. The muzzle blast, that force is going to be different with the dog standing 3 feet up here versus right behind me. And also the effects are going to be different, let's say from a breaching charge on a door, with the dog being the first or second in the stack away from the door, 6, 7, 8 feet versus in the back of the stack. So can you speak on positioning the dog, not even from a DB standpoint, but from an overpressure or blast pressure positioning dog, and making sure you're taking those things into consideration, whether you're shooting or doing breachings? What should we be thinking about in terms of those?
Well, first thing I can tell you is data that we have, working with Becca down at Fort Bragg and so on. And we've done a lot of work together there it is very typical for even pet owners that in obedience training, dogs are trained to always heel on the left side of the handler, which mythologically comes from the fact that, I don't know if it was the Old West or whatever, but most shooters shoot with their right hand. So then what do you see? You see left ear, is being challenged, and more so than the right ear. So the left ear is going to fail first. Where should the dog be? Again, I can't speak to how every department, police department, or even in the military. I know in the military, if you're if you're getting into a bad situation or a potential firefight or something, and the dog is, trying to look for insurgents, he's, somewhat 20 feet out in front of you. And so, don't know what's going to happen out there. I don't know what the noise level is. I don't know how the dog will react. I know they're trained for that. I think that to be cautious is to try not to put the dog in a position where it's going to be first and foremost to the blast. But again, I'm not, I should because I was, formerly a diving board bomb tech, but I just don't, I just can't do that. Just again, it's vigilance. Common sense would tell you, don't put the dog in the blast zone if you can help it. Sometimes you have to do that, but I don't think that it should be a common kind of a thing to do that when you're setting the blast, or whatever the case may be. Yeah, I mean, that's a, and will it have cognitive effects? Like I said before, the nervous system is being attacked. Yes, there's going to be cognitive effects.
Right. Well, so this all goes back to what you said initially. I think it was in episode 1 or part 1. It's a shame that nobody takes hearing as as serious or treats it as a broken bone, when in reality this could have, for a dog anyway, um, horrible effects if not taken into consideration at ages 7, 8, 9, 10. Whether it's neurologically, TBIs, PTSD, it goes well beyond just hearing damage. Um, it's a quality of life at that point. It's a quality of
Well,
life.
it is. And, I can tell you that 9 out of 10 times emails or mail that I get, or even phone calls, somebody will call up and say, I have a dog and I'd like you to put a hearing aid on my dog because now he's getting a little bit older and, and I want to keep his quality of life high. You know, Usually my first response to that is the mere fact that you are calling me to ask to do something like a hearing aid or something like that tells me that you are an owner who has already given the dog, a good quality of life, or you wouldn't even be asking a question to start out with. But there's only so much that can be done. I just spoke to someone today out in LA, and he's got a 14-year-old dog. At age 14, even a small dog is nearing the end of his life, just on the statistics of, how long a dog lives. And so, like people, the dog may also have presbycusis, which is the deterioration of hearing with age, which happens to people all the time. That's why grandpa's wearing hearing aids. I mean, it's the whole thing there. So, yeah. Again, the best thing that I can tell you is don't put the dog in a bad position with regard to blast. Be vigilant about what you're doing because, if people won't do it for themselves, I will tell you that if we saw 5 people in audiology, 5, and 3 of them were men, the men are going to always say to the clinician, when they ask, well, okay, what brings you here? The answer is always going to be, because my wife just keeps on badgering me to come in and get a hearing test. But that doesn't, what that tells me is that's a kind of a person that will say, I have something wrong. I'm having, chest pains or whatever like that. But I'm just not going to go to the doctor because on any other day I can go and do what I'm going to do. Well, if you're not going to look after your health, then what's the point? And that must apply to non-working and working canines, period. It's vigilance. It's talking to your vet, whatever. You got to do it.
Right. 1000%. That, outside of, again, training or mission, specifically going back to kennel situations, I would go as far to say, you have to, and this kind of leads me to the next question, throwing up some type of, I can't just put pieces of cardboard up in between the kennels and say I'm dampening noise, right? I have to dig deeper than that. I can't just, it's not good enough. So going to, if I had a 30 dog kennel, CMU or concrete walls going 4 or 5 feet up, and then past that's chain link. So you can obviously have DBs leaking all over the place. It's a metal building or a concrete building. And there's plenty of opportunities for DBs to leak and just reverberate all over the place. It's a horrible, horrible situation. What type of materials, if I'm going to throw up sound dampening panels, we all know, I think, if we think about our own hearing protection of the typical, you see the orange ones you use at the construction site or shooting, whatever that you always put in your ear, and the foam expands slowly in your ear, blocks your ear canal, right? So some type of foam, gels. What should we be doing? Because I don't think any of us just want to throw up wrestling mats or pieces of cardboard. Again, what should these kennels be looking for in an acoustical panel to set in between these kennels to really make a difference in dampening sound? What should we be looking for? What should we be doing?
Okay. Well, there's a difference between building and, where the dogs are going to be staying and, doing hearing protection devices. I mean, you could put a dog in a kennel and put hearing detection device on them, but the kennels have to be safe places for dogs. They have to be washed and all kinds of stuff like that. And now I'm talking the Allison line here, is that the, you got to put some
Here we
money in,
go. Right.
money talks and bullshit walks, that's what it is.
Because I would
And
say when
so,
I listen to you talk, I'm sitting here listening to Alex and I'm thinking, after everything I've learned in this last few weeks with y'all, I mean, think about it, Alex. You've got, I mean, I'll tell you right now, and I'm in a state that would not be considered at the top of the policy world on animals. I would say that out of the 67 counties in Alabama, the impoundment facilities in Alabama, 99% of them are exactly what you just described. They're housing 40 to 50 canines per part of the building, and it's a metal Butler building. So they're doing everything they can just to keep that thing sanitized, distemper, parvo, all that. And then here you come and you're trying to figure out, I mean, after learning everything I've learned from y'all, how in the world are you going to put an acoustical panel in there that can survive bleach or rescue any of the chemicals that they have to use to kill the diseases that come with holding an animal that is off the streets that may not have been vaccinated until it arrived? Man, it is overwhelming when I think about it. How we would come up with that panel. What would that panel be made of? How could we clean around it? But I've thought about it a lot since I've met y'all. Thanks a lot.
well, I mean, I've said this before, kennels in the 21st century are still being built the same way that they were built pre-World War II. Okay. And again, not for nothing, because, humanity had a lot on its hands with world wars and things like that. And, what people are trying to survive. But, I can remember being stationed in Pearl Harbor and on Ford Island, which is where the seaplanes and other planes took off from, and the battleships were parked around it. You can still go there to the airfield and see these cages where the security dogs were kept on the flight line. And I've had a couple of people from the military ask me and say, well, we're trying to be, uber ready. We want to be ready for everything. And so, my superiors want to have a ready place for the dogs to be, on the flight line. Well, then you're asking for a problem,
They are here. They're here at the Birmingham Airport. That's exactly where they keep them.
I mean, come on, Einstein, figure it out. You just, you gotta be thinking about this. It's the wrong place to put them. I understand you want to be ready at a moment's notice, but there are better ways to do it. Now, having said that, back to the kind of the real answer to the question is, like I say, you have to be willing to, for people at kennels, whether it's the Humane Society or otherwise, you got to be willing to throw some money at it. And right now, I a couple of months ago was invited to attend a meeting at the Pentagon, and it was at the meeting were all people from different bases and all the veterinarians from the different bases. And the whole purpose of that meeting was, what do we do about kennels? Now, come to find out from some of the engineers in the room, and is that there are a lot of new materials coming out. Technology is advancing. We now have floors that can be washed and cleaned and disinfected, but they are absorbent. So that means you're not getting the amount of bottom bounce off the concrete. There are any number of sound mitigation panels that, the dogs can't chew on, and they're impervious to water. And so then you just have to be smart enough to do the protocol that is going to do that, which means you've got to take 24-hour sound readings. You got to do an RT60 for reverberation. You got to do, some, measurements and things like that. So you get everything in the right place. And so throw some money at it, get the stuff exists. You just got to go get it. One of the things that I mentioned when I was there is, because I was asking, well, what do you guys use when you mitigate kennels? And ARO had me going around looking at kennels at different bases and stuff like that. For sound panels, if you go online and look at a place called Lab Products Inc., okay, they make panels called Sound Break, not sound with a D, but SOUN break, that you can wash around them. You can, dogs can't chew on them and things like that. You can get the proper new kinds of flooring, and then you just need to be conscious about actually doing all of the correct measurements and reverberation things, and and just throw some money at it. Do it.
I know I was about to throw 37 million at it. $37 million.
Well,
Y'all
and
understand? 37.
Hell, I can't even get people to throw 1,000 at it.
Yeah,
Are you kidding me?
$712 a square foot. When
Well,
I told everybody that to build a kennel that would, because our goal when we met with Animal Arts in Colorado was to build a kennel that would, because obviously the smart thing to do, I mean, it sounded smart to me, is try to reduce the barking. To try to reduce the triggers of the barking. When they came back with 700 a square foot, my husband, he builds hospitals. He said, we build neonatal intensive care units for less per square foot than you want to build this kennel. And I said, he almost had a heart attack. And I think they have us limit. Yeah, he had us limited, Dr. Skip, to I think maybe we have 12 to 14 kennels per pod. And it's a completely sealed off pod. Well, we care for 18,000 to 24,000 animals a year. So you can imagine our census per month, how many animals. So imagine how many pods I had to build in that design in order to accommodate that many animals on any given day. I almost had a heart attack, but now, now that I've raised so a lot of the money, it just feels like chop change. It's like once you get past 20, 30 of it, it's like, well, that big a deal. It really is weird. When I first heard it, I almost had a heart attack, but I'm
well
okay
done.
now. Thank you. But then, I had this little AI factory coming up. That's okay. It's going to be all right.
Well, and unfortunately, I think it goes back to, again, the basis of this whole conversation. Hearing it in terms of the money and what people wouldn't want to spend. It's not a broken bone. It's not an immediate issue. It is an immediate issue, invisible. And that's why they don't care to throw money at something that, well, who knows? Maybe it's not an issue. We don't know. Forget about it. Well, we're not sure. So we do need this. They said this is more pressing. No, I'm sure this is fine, when they don't even take the time to test, use the proper devices to see what kind of dBs and reverberation they are getting in those kennels. And I would go as far to say, even after you go through, hey, we purchased all these panels, we switched our floors, so we're good now. No, not necessarily in terms of acoustics. And from our conversations, Dr. Shipp, I know placement of those panels, whether it's ceiling, whether it's wall, whether it's hanging up in the air, how it's trapping those dBs and how it's dampening, that's a big factor too. So just because you hang them up on a wall, don't call it good. You still need to bring in the proper devices and take the right measuring, the right test after the fact to make sure you're doing it correctly. Don't just slap a Band-Aid over a gashing wound and say, well, we're good. Like, no, you have to make sure.
You have to use the right protocols.
Right.
If you don't, then it's hopeless. You might as well not do anything.
Now I've
And
got
that,
a question I want to ask that you asked Alex that I want to ask Dr. Skip that comes off your question that's for just regular people because y'all use a lot of terminology. And now that I've met the two of you people, I think it was brilliant to have me on here because I'm the dummy of the three. But yet, guess what? I got news for y'all. I represent the majority of the people you're trying to reach. So lucky y'all.
you got it. You
So
got
one
it.
of the questions that I got asked was, what are the warning signs that an animal is suffering from chronic noise stress, and what should either a veterinarian who has a boarding operation behind his business or a pet owner look for? Like, y'all use a lot of acronyms because y'all are military. What are the warning signs that the dog is actually doing that an average person can go, okay, there's something's wrong, other than he's not
Okay.
coming anymore when I call him?
No, that's a very good question. And like I say, the problem is that people don't even do it for themselves. You know, it's back to the guy that says, I'm only here because my wife is badgering me to come here and get the hearing aid.
Right.
But you, you, you start to see signs and symptoms from the dog. It may be the dog is not eating the way it used to. The dog will start to show signs like when you get a dog that's uh, contralaterally deaf, both ears. One of the first things you see is that they want to be with their people. And so what they'll do is they'll either be close enough to be touching the person, or a lot of them will lay down across the threshold of a door, because then they know when you have to walk over them to get out of the room if you're going to leave. So you start to see these little signs that are there that will intensify as the hearing gets worse, to the point where they'll be asleep and you come home and walk right over them. They have no idea they didn't even know you were home. Again, that I tell people, owning a deaf dog means that you, as the person, as the family, you need to make behavioral changes to accommodate that dog.
Okay.
Dog's not going to do it. You have to do it. And to do that, you need to be smart enough to be, to be watching and be vigilant over the kinds of changes of behavior, changes in eating. Now, maybe changes in eating is not a hearing thing, because
Right.
that can do a lot of different things.
Could be anything.
But it's well worth the money that you will spend to go to your local veterinarian and say, could you run a bear test on my dog?
Right.
Becca and I, as far as military going, we're trying to set up a hearing conservation program. Hearing conservation programs are things that large companies, any company that deals in things that are going to be noisy, are required by federal law to have. Anybody that's
Then
working
I'll
in
tell you
those
right now,
positions.
I had a bunch of people after they listened to the podcast that run out there. All of their boarding kennels are outside, but they have concrete. So I would never say their names. So we went to 2 or 3 of them in the last 3 or 4 weeks, and the measurements that were taken at almost every single one of them. This is a place you would leave your dog for a week while you go to the beach. Okay. Exceeded 120 dBs. And of
Okay,
course, you're going to know. You're good.
Now
I'm going to tell you what happened. They even
I'm going to be
videotaped.
cranky and ask you what kind of decibels are we talking about?
I know.
Typically,
That's why I sent you
when
that
somebody
email.
like Nebius or whatever does it,
I know.
and they're looking at DBA.
I think it really shocked everybody just to even get that back, because then they were worried not only about the animals but about their staffs.
Yeah.
Because
people are not supposed to be in that.
I know. And so they were a little bit surprised to find out that it was that noisy. And of course, it got real out of control at feeding when they came to get them out for playtime, exactly when you would think. But none of these people had thought about any of this. And they certainly had not thought about the fact that some of those dogs are being boarded there for a solid week. And so that came up. And in that conversation, as I was going to 2 or 3 of these places,
making.
yeah. a lady that was standing with us, that was the wife of one of these veterinarians, said, Allison, you know, you see all these videos all the time and everybody thinks it's so funny on Facebook Reels or on TikTok. And there are people are running their vacuum cleaners and the dogs are attacking the vacuum cleaners and they're acting completely bizarre and out of their minds. And they think it's really funny and they just keep doing it. Is that an example of an animal
Yes,
that is having, okay,
could be. It
straight up.
could be.
Okay.
You know,
Well, I
here's
mean,
the case. Here's the case in point when you talk to some of these folks about, you know, being observant and being accommodative. 4th of July. How many dogs get put into bathrooms, basements, whatever, and they're absolutely traumatized by fireworks that, you know, if one thing, if it was right next door. I have a neighbor here that in a right next to my pasture, they shoot fireworks off, and my 2 horses are absolutely traumatized by it.
oh, wow.
You know,
And see, I gave that advice. I gave everybody that advice for
yeah,
July 4th. I said, look, take your animal to an interior room, run a box fan like the one behind
yep.
you, try a hatch sound maker, try putting on classical music because that's about the best I can do. But I will tell you that I think this had something to do with meeting the two of you. Um, I went to a July 4th event that had thousands of people at it, and two guys went right in front of me to the very front. They were probably 50 yards from where they were shooting the fireworks with a doodle. And the whole community was looking at me like, what are you going to do, Allison? And I walked over and just said, hey, I can take your dog inside the club here. And they didn't want to, but I did watch the doodle. I videoed it actually. I watched the doodle during the fireworks show. And the guy came over to me. The dog kept vacillating between getting down and then standing up and tucking its leg, but then wagging its tail when the guy would reach down. But then it would get down again, tuck its tail, pace back and forth, and then it would wag its tail again. And the owners, I think, told me afterwards, well, Steve's wagging his tail. There was nothing wrong. And I said, look, I don't have time to get into it, but I've met this guy from Cincinnati, and I'm just going to tell you straight up, this was a terrible idea. That's all I knew to say. I mean, I literally just said that's, and I put it on Facebook. I was like, look, that's all I know to say is it has completely changed. But they really did think there was no problem because their dog was not
Let me ask
running
you,
around.
how far away from where they were standing would you guess the fireworks were being
I
shot
know,
from?
50 yards. And this
50
was a
yards.
major
Okay.
fireworks show. Yeah, it's a private country club fireworks show.
Okay.
It was a huge
The
show.
average firework, the average explosion from a firework is 156 decibels, 1 meter away from the firework.
I remember you
Now,
telling
you
me.
can calculate out to 50 yards, and then you'll look, then you can calculate it and find out how much less the intensity is. There's calculations for that, which of course nobody would think about except, you know, some dumb doctor like me. But you know, the point is, yeah, it's not a good idea. You know, and granted, it
That,
only comes up once a year, maybe, because maybe that's all, maybe they only go down there on 4th of July. But nevertheless, here's the thing. People don't get the idea when we say that you had a permanent threshold shift, whether it's a Jimi Hendrix concert or it's a fireworks or whatever like that. Temporary threshold shift literally means you have done damage to the hair cells in the ear. Damage. End of statement. Now, if you keep doing that, the damage will get worse and worse and worse until the hair cells shear off in the inner ear. Now I can't hear. Okay, that's a permanent threshold shift, but it's damage, even though it's temporary. So saying, well, you know, he was acting really weird, but then, you know, they're not acting really weird, and you know, a minute later, whatever like that. You know, if it's your dog, you're part of the pack, if not the alpha of the pack, and so the dog, you know, relates to you somehow, some way. And if
right.
you pet it or whatever like that, you know, the response you're going to get is, you know, the dog likes that or whatever. But if you take your hand away and you just stand there watching, and all of a sudden you have all these, bomb like sounds going off, then, you're really not doing a good thing for the dog. And
So,
it's
yeah,
gonna be behavioral.
the other thing I noticed after meeting you two guys is I started noticing a lot of the industrial projects stop measuring at 8,000 HZs. You look at them and they all seem to stop at 8,000 hertz. And I asked one of our board members who's a veterinarian, and he said to ask you, it's a hilarious question. He wanted to know, is that gap an accident or is it just cheaper not to look? Like, why
Say
is
it.
it they all, I noticed the same thing. Like every time we kept looking at these studies, including the one on the AI factory, they seem to have this magical threshold of 8,000 hertz. Like they all have 8,000 HZ as a number. They'll have the dBs too, but they'll have 8,000 seems to be this magical number that you see everywhere you look at a study, an industrial noise study. And when I noticed it, and I brought it up to Dr. B, and he said, I noticed the same thing. They stopped measuring at 8,000 hertz. So he was like, is that an accident? Or did some committee get together and say, let's don't go above 8,000 because it's just cheaper not to look above 8,000? Like, why do a lot of them only go to that number?
Mm. Well,
What's above the 8,000 HZ? What's over the 8,000 that nobody's? What's up there?
well, again, this is all based on human hearing,
Yeah.
and the best frequency range of hearing for humans is between 2,000 and
Right.
6,000, because that's the range of human speech. And our ears are designed to hear another person talk, not to go doing other things. Now, yes, a person with good hearing, can they hear above 8,000? Yeah, technically you can hear up to 20,000, which you'll only be able to hear all those frequencies 2 years of your life, age 17 and 18. But then, so
Unless you're in the CIA.
that lets all of us out. Yeah, I get, but the bottom line is, high frequency, I don't know how to put this. High frequency sounds dissipate rapidly.
Okay.
Okay. Tweety birds, have to be relatively close. A bat has to be within 6 inches of a mosquito to even realize that the damn thing is there. Okay.
Okay.
Low frequencies travel very far. The lowest frequency that we know of on the planet would be a seismic wave.
Okay,
Which
that's a good analogy.
when it leaves Japan, by the time it reaches Honolulu, you got a wall of water 150 feet high.
Okay,
But
that makes sense.
but for a dog is hearing all the way out to 57,000 hertz. Okay. And at that point, sound doesn't last long. It's such a high frequency. And so audiologists typically don't test past
Okay.
about 8 kilohertz, because why? Most people can't hear that. We're starting to do that now, where audiologists may, depending on what the patient's history is, but if they're having problems with ear infections and stuff like that, they may test out to 12,000, because at that frequency is really the only good place that we can test to find out if the ear has suffered ototoxicity by what you've been putting in it.
Got it.
So it's all based on human hearing.
So you two, y'all have worked with all these animals and you've worked in the military. Y'all have learned all this stuff. What have y'all learned about noise in animals that civilian regulators haven't caught up to? Bottom line, if it's the biggest thing, what if regular veterinarians, regular shelter directors, even regular dog trainers, not military, not like, what have we not? Because I'm gonna tell y'all something. This has been eye opening for me, because I'm Ivy League trained. I'm Ivy League educated with 147 IQ, and I never thought about any of this until I called Skip. I never read this in People magazine. This was not in a single textbook I had in school. It's not in any of the shelter textbooks. Nobody mentioned this to me till I met Skip.
And I always say, audiology is the last thing on the list. It's just not.
Well, y'all are going to have to
Audiology
get it a
is
little,
not
y'all, you
something
two are going to have to get it a little sexier to get it on my radar because this is ridiculous. I feel terrible that I have never thought about this. It has been on my mind ever since I met y'all. So what is it that y'all have learned that we better catch up to?
Well, I can tell you that thanks to the Orthopedic Foundation for Animals, congenital hearing testing is a big thing. And, you know, more than not, veterinarians can run a bear test. The equipment's expensive, but they can do that. The difference between them and Fetch Lab Animal Audiology is that we have other specialized tests that we can do that unless you've been trained in audiology, you're not going to understand. But the bear test is the main thing. I mean, we've gone from when you would take your dog in and the vet might, jangle some keys to see if he gets a behavioral response. Well, that's not a good hearing test. Now we have the technology to actually do this brainstem auditory evoked response test and get meaningful information on the status of the ear as far as hearing goes. Where that's going to go in the future, I mean, it's all changing all the time. But generally, these changes happen because the ENTs and colleagues that are MDs otherwise, whether it's internal medicine or whatever, have a need for something that is more accurate or whatever the case may be. And so the technology will advance. But this is where we are right now. But even so, with that, unless the patient, the dog, meaning the dog's owner by default, has to be vigilant enough to look and say, why am I seeing things that are not the same? Or in the case of the military, when I'm talking with Becca down in Fort Bragg, why should the military have to go through having hearing conservation programs for dogs and handlers? Because they need to be tested annually. You can't not do that.
Okay, I see what you're saying. All right.
Now, I will say this. I
And they're
see
expensive.
patients that come in to Veg Lab and they'll want to have a hearing aid. When we first started putting hearing aids on dogs, we put in what are known as BTE, behind the ear hearing aid. It has the tube that runs down into the ear. You've seen your grandparents have them. And so then a person comes in, they want to have a hearing aid put on there. You're talking $3,000 to $5,000 to put a hearing aid on that dog. And so, one of the original ones that I put on was it was a 911 dog actually, and actually the people didn't spend enough time in training, and so they had a party one night, and the hearing aid fell out of the dog's ear, and somebody stepped on it on the dance floor. And what I got in the mail was an envelope full of basically electronic trash. So. But now we've become more advanced, with that. But still, it requires behavioral changes on the part of the owner. And I get some people that would come in and they're willing to take a second mortgage on their house to put a hearing aid on their dog.
Well, yeah, but look at what they're spending. I mean, think about what they're spending. I don't know how much Alex charges, but around here, if you want to send your dog to training to a really good trainer, you're looking at $6,000 to $7,000, $8,000.
Sure.
And I bet you not one of those flipping trainers has thought to test for hearing or has thought about any of this. They've never mentioned it to me.
No,
never.
But it's just like human medicine. I see people come in that were willing to take a second mortgage on their house to put a hearing aid on their dog, or hearing aids actually. And on the other hand, I've seen people pull up in like brand new BMWs. And you tell them, well, your dog has a hearing loss and they're going to get rid of it. They don't care. So
you're right.
This quality of life thing is, it fluctuates. And you see the same thing in medicine. I get, people that come in and they're all about Google Doc or, whatever, or they just don't come because they're just, too lazy to do it. And it doesn't, it'll be meaningful when when you're dead and on the table. That's when the meaning will happen.
Right. Yeah. And Allison, I'll answer that question from an operational and training side, just from what I've seen talking and dealing with different departments or units or groups, what have you. You asked, what is that side of the house, or what are professional handlers and professional military working dogs, just working dogs in general, doing different from the general public and civilians? Honestly, from what I've seen, unless they personally ever dealt with Becca or Dr. Skip direct and have this knowledge, not a whole lot or nothing. Let me be honest.
That's right.
And it's not because they see it and they hear it and they say, I don't give a crap, screw it. It's just, you don't know what you don't know. That's why we're doing this series. That's why we're having these conversations. So hopefully now, if after you hear of all this and you still go, I don't care, that's your problem. That's on you. But I would hope that if you hear about all of these different ways to, not overreact or become a hypochondriac or freak out, but be educated, be aware, stay vigilant. Now you have the ammo to help start at least fixing your kennels, help start the path of getting the right ear protection, changing your SOPs and TTPs when you're working, your training protocols when you're working with your canines and your military working dogs. Now we are going to put an order in for 20 caps or 20 rec specs here when we go to the range. Again, I still see, people shouldn't just assume, again, and I'm doing this, I'm saying this as tactful as possible.
I'll be on tap if you want me to. Because I'll tell you exactly what I told you was going to happen when I called and said, I will pay for all of the Snoop, whatever they're called. I said, I'll pay for all of them. Right. I'm not going to say which LEO group it was. They did exactly what you thought, exactly what I told you. I thought was what they were going to do. They were like, what are you talking about?
But there's individuals, I don't care if it's general public and civilian or LE or military, it's just humans in general. There's some humans that genuinely care. Like Skip said, that they'll
crazy.
They'll take out a second mortgage, or fight tooth and nail for their dog because they realize the importance of what a dog brings to their life or their mission or their task at hand. What that's worth. And then there's other people that, like Skip said, drive a G-Wagon and have $1 million house. And as soon as they have to drop $1,500 on, getting the dog tested for heartworm or whatever, they say, screw that, off to the pound. It's just a lack of being aware of the, I would say, the advantage or all the positivity that a dog can bring to your life and your situation. And that, again, that's not just LE, that's not just military, that's not just civilians, it's humans as a whole, how we think of dogs. So yeah, you got handlers that should never have been a damn handler from day one. They get handed a dog and they don't give a crap, and then it dies in a hot squad car. And then you have other handlers that take it.
Yeah.
And then you have handlers, and I think I'm not this specific, just saying, and handlers.
You're not talking about him
with that dog and treat it like family. It's just two different sides of the coins. But I would hope, I like to think that when everybody hears about this, you can't just say, I don't care. My God, if you do, what the hell's wrong with you? After we've had all these conversations, like,
I know, but I just want to say this as a civilian person. Thank the Lord that dog handlers, dog trainers, and people that work with canines have such a very humble ego. Thank the Lord. That's me being sarcastic.
But you know what? This is a
that's me being sarcastic, Alex, because that's part of the problem right there.
This is a Navyism that I tell all my students, and especially my audiology and animal audiology students. Okay, animal audiology is tough, but it's tougher if you're stupid, and it's impossible if you're stupid and don't know it.
Well, but I'm just saying, I told Alex when I had a private conversation with him, I said, when I go tell them I'm going to order these hats, they're going to say, Allison, what the heck are you talking about? And I can tell them all the stuff because they're, you know what I mean? Machismo, no, you know exactly what I'm talking about.
And this is
why.
And
I'm not saying, and I will say that as a profession, most of you guys and gals in this profession, y'all are better looking than the average bear. And I don't think that doesn't help any, but y'all are a good looking lot. But it would be nice if y'all would just have a little bit of a teachable spirit sometimes. Not you, of course, Alex, but some of your peers. Because when I offered to buy the hats, I offered to buy 70, 80 of these hats. I would pay for them. They were like, what are you talking about? Well, our dogs have got to be able to hear when we're on the firing range. That's going to mess up exactly what I thought they were going to say about the proofing and all that stuff. So it was very interesting reaction. Although I
Yeah.
did have one person that was a sweetheart. That asked, who did listen to the second episode and came back to me and wanted to know how Skip ended up becoming an animal audiologist, and wanted to know, he said, I didn't even know that job existed. And what do you have to do to be one of him? Now, I will tell you now, it was a 16-year-old kid that was there. It was a 16-year-old
Wonderful.
boy, an
That's
explorer
good.
scout.
Yeah.
But he listened to the show
Start
and he called
young.
me and he goes, how did he end up doing that? And what do you have to do to be that? I was like, I have no
Actually, had
idea.
a similar question. This is perfect. No, this is perfect.
So how did you end up being what you are, and what do you got to do to be what you are?
Probably 60% out of stupidity, but I mean, in my last 9 years on full active duty with the Navy, I became a naval oceanography officer, and at that time, then I was given the task to begin working with marine mammals, dolphins, whales, sea lions, things like that. That kind of put me over into, once in a while, dogs. But when I took the job at the University of Cincinnati as a professor in the Allied Health and Medical College, if you want to make tenure as a professor, you got to have research. You got to do some research. And so my deciding factor was, well, I do a lot of work with animals. I have done a lot of work with animals. It's not something everybody thinks about, but since I have a clearance, and since I was able to approach the Army Research Office and Stephen Lee, I decided that I would start Fetch Lab. Also, the reason for that was because I realized that if a student comes in and wants to get an AUD, that's Doctor of Audiology,
Okay.
they learn all the technical stuff about audiology, about hearing, about noise, and all kinds of things like that. But nowhere along the line did anybody ever describe to them, how did our ear come to be what it is today? How did a dolphin ear, how do they hear? Did dinosaurs actually make sound? Did they actually hear? No one ever told them this. They just threw them right into the clinical pack and said, here, test, you're going to test hearing. And so I thought that, it probably, wouldn't it be a wise thing to give them the background before you started having patients and things like that? Get an idea of, where things are. I mean, we know today the most primitive ear on the planet right now is an anurine frog who can only make one or two frequencies and doesn't have ears. So, when you start doing that, reptiles, birds, blah, 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 all the way we are. And so that's when I started Fetch Lab. How do you get
an MD? Like, do you have to have an MD?
No, you have to
you
be.
Can be a. You have to. You can be
either be a PhD. You have to either be an AUD student or already have an AUD and are a practicing audiologist. Even that's team clinic.
So, like a kid that wants to go into this, is that like a science? Are they going to get a Bachelor of Science degree in what? Biology or something? And
well, the bachelor's really doesn't make much.
They could be in English.
Difference. Could be, but you want to set yourself up with courses that you're going to take that will be amenable to science, and specifically acoustics, and more specifically audiology or speech pathology.
Okay,
So,
got it.
so there you go. I mean, and so, to get the certificate, you can only get it from UC at this point, because I'm the guy that invented it, sort of. And so, and I'm sure that, it
No
goes back to
plug
money
there.
too. The more people you can rope in to pay tuition, the better off you are. But
Is it
um,
online? You know, that's what they're going to say.
yes, yeah,
They
some
get it
some of
online.
it some of it is online, and some of it is not. Most of it is online. So you're
Okay.
required to take 12 credits, 3 courses. The first one is the course where I describe hearing from Jurassic Park all the way up to the present day. And then the second one is a
Okay.
seminar in animal audiology that mostly centers on canines. Okay. And then you have to take 6 credits of practicum. In other words, you need to come work in the lab. And even some
In
of those,
Cincinnati, they got to come to Cincinnati, right?
I like it if they do, but if they don't, I usually work it out. I might work it out with one of their local veterinarians to shadow them and see them do
All right.
bear testing and whatever like that.
Got it.
And then you have to take a qualifying exam. And if you pass the qualifying exam after those courses are all done and you have the credits logged in, then you can apply to graduate with your certification.
And then you make $1 million a year and you are home for glory. I got it.
You know what? It's funny that you mentioned that, and that's a valid question. What am I going to do with this when I get done? Typically, what will happen is the animal audiology, when they have their certificate, will go visit their local veterinarians in their town or the towns nearby and say, hey, I'm an animal audiology. Here's my certification. How about if I do animal audiology? I'll come, visit you twice a month, and I will do all your bear testing and, analysis and everything like that. And so then they work that, and it's a little extra cash.
Okay.
And other ones have actually, especially if they're at a university, have started actual fetch labs that also come under me at the University of Cincinnati. And so they're working for a university, but they're working for a fetch lab. So, I mean, and that's pretty much, what it takes to do it. It's not all that hard. The courses that you have to take, I teach them in summer, every summer, all those courses. So, I'm teaching like
So they
6,
can
7.
skip I did tell this kid he does not have to dive into the ocean and undo a bomb. Is that
No,
correct? Okay.
no, categorically not.
Okay, that's
Most
excellent.
of
I'm glad
most of
that.
them will never probably. Only have one that
Good to know.
she was also my PhD student, and she started Fetch Lab New England. So they're covering Boston, New York, Connecticut, blah blah
Yeah, a
blah.
little water there, but it looks like most
Yeah,
of our conflicts seem to be happening on sand. So
yeah.
I think for right now,
She doesn't
probably.
but she doesn't even dive. I mean, she works for the Navy as a civilian contractor, and so it's good for them because they get her expertise for that. But yeah, I mean, it's not particularly hard or long drawn to try to get the certificate, because that's why we only take AUDs, because they've already been taught human audiology. I don't have to go back and teach them all that. I need to now turn their attention to dogs, cats, dolphins, tigers, whatever the case may be, which is, by the way, a huge step for them, because they find out very quickly running an ABR or bear test on a human, not like running one on an
I know,
animal.
and I'm going to tell both of y'all right now, and your people, if they hear this podcast, need to hear me right now. This whole situation happening in Nashville, Tennessee right now, I can't wait to see who's going to go do that hearing test on those animals. Because if you think my situation, I'm doing an interview tomorrow with Bloomberg. I bet you anything, Skip and Alex, it's going to be easier to do what my dogs than it is a cloud, what is it? A clouded leopard, a rhinoceros, an elephant, a tiger.
Oh yeah.
So I'm
Yeah.
just saying, my situation is going to be a heck of a lot easier than that situation in Nashville is going to be.
Oh yeah. My crew here
Good luck.
at UC, we've been working with elephants in South Africa for 8 years, and just
Well,
started
I'll tell
2
Rick,
years
I'll tell the
of only working
CEO
with
to give y'all
rhino.
a ring,
You know,
because
I
I
get
wanted, you
people that
need to
come,
be
they
present for
say,
that hearing test.
people come to me and they're like, well, you know, how different is it? I said, you haven't done a hearing test until you're having to stand next to a 3-ton elephant and try to do a hearing test on that. You
That's
ain't
all I'm
seen
gonna
nothing
say.
yet. But on the other hand, to be sure about the question about, you know, are you going to make $1 million? You know, don't quit your day job. That's what I always tell them. You're an
Well, I
audiologist.
guarantee
Most
you,
people don't quit your day job, but you can make more money. And the more we do this, the more it spreads, you know, far and wide, the more we're bringing people into focus on this is
mark
something we should
my
be concerned
words.
about.
Mark my words, gentlemen. Whatever. Today's July the 15th. It's what o'clock? It's 4 o'clock here. You better mark my words. If they end up building that that data center next to the Nashville Zoo, 400 feet away, I don't know who's going to go do the hearing test on all those zoo animals for Rick, but whoever it is, it's probably going to be you. Maybe Alex will be helping you. I guarantee you that you're going to be making some bucks there because they got enough celebrities around Nashville to pay for it.
I'm sort of getting that opinion that, you know, you already captured me. Yeah, you got to capture Alex too, because he's now part of Fetch Lab.
Can you
So,
imagine,
you know,
Alice, what that's going to be like after Brad
I'm here
Paisley and
for it.
Dolly Parton? All these celebrities are coming out, and you're going to have to find a bunch of people to go do hearing tests on a flipping elephant, rhinoceroses, and tigers and everything. I'm going to look like a walk. I'm going to look like a walk in the park.
I'm here for any type of help or trust me,
you
I'm
know, I,
go ahead.
you know, the first cheetah that I ever tested in Africa was not an animal that was sedated. He was live at
You-
5, brought into a hut with me. And as long as he kept on licking the sweat off of my arm, my technician who was an audiologist, got the test done. And
No.
I told her when we started out with, if this cheetah stops licking my arm, get the hell out of Dodge, because
Yeah,
he's
because you're going to
not
be
going to
missing
be a
an arm.
happy camper.
Right. Like I said, I'm lucky that we hadn't built the other 2 phases of the buildings. We did build the largest building, but maybe I can figure out a way to get us out of this mess. If we had already built everything and this thing ends up going through, I mean, gosh, because they're going to have to do the test. They're going to have to.
Right.
And they're still not out of the woods in Nashville. The mayor's trying to get the eminent domain, but if the legislature cannot stop it, and if the public opinion can't stop it, and DC Blocks is absolutely hell bent on building it there. I can't imagine what that public relations department's like. But at any rate, if they go ahead and do it, somebody's going to have to do some annual tests on those dogs. I mean, on those animals. There's no question. I'm just trying to think in my own. I can't even fathom how you would approach that one. I could see how you would approach us because it's dogs and it's cats. I don't know how you approach 3,500 different. He has 3,000 different species.
Right.
I think that's what he said. 3,000.
Yeah, we're doing the Audubon Zoo now, and that's a New Orleans, and that's a whole different thing. Let me say this for the record, Allison. Thank God you do what you do, and I do what I do, because I'm in my own little box. You know, I'm perfectly happy doing what I do. I'm sure that I probably would have.
That's why I have
this
painting up here. That's why I have this painting of Abraham Lincoln with a mat book with the Grateful Dead on it. It keeps my sense of humor. That's why I have that there to keep me. That's a painting. That's not a poster. That's an original painting by one of my volunteers.
Wow.
Isn't that amazing?
Well, I was going to say, from dog training and what have you, I already have probably well over 20 bite marks and gash wounds on my arm from K9. So, if there's a couple more to add from a cheetah or lion, I guess that'd be cool.
Yeah, we'll see how that works out. Okay. That's hilarious right there.
Well, I'm going to piggyback off that real quick, Allison, and because I had a very similar question for Dr. Skip. I was thinking about this yesterday. I know we just kind of went on the ins and outs of how to get to where you are in your career, Dr. Skip, professionally. Was there ever a defining moment for you in early on in your career that drove you like, you know what, I want to do audiology. for animals. I really like this scope. I like where this is pushing. And like, was there a specific moment or event that really sealed it for you? Or was it more or less just year by year by year, just kind of gradually pushed you in this direction?
Oh boy. Let me kind of get right to it here. After diving and riding submarines for about 17 years, um, I I was interested in sound because of sonar. But when I became a commissioned officer, all that time before that, I was an enlisted guy on the bottom of the pile. When I became an officer, you have to go have a 4-year degree. So they sent me to school. The good part was I never paid a dime to go to school. But they sent me to go to school, and I got my degree in physics and physical oceanography, and thought, okay, now I'm going to go back to work. It's good. Well, no. Uncle Sam came down and said, no, um, you need to go get a master's degree. Okay, so what? And they said, now you're going to take mechanical engineering.
Oh God.
Okay, I don't get it, but I'll do it. And so then I got my master's degree. And then they said, we want you to be working with dolphins, but we need to know about dolphin hearing. So therefore, we're going to send you to medical school in New York City. So I did that. Having done that, I came out and they said, well, you need to have a PhD, but you need to have a PhD in animal science and with speech and hearing science with it. And that's when I met one of my favorite guys, Frank Music, who was in audiology. And so then I got my PhD. So was there a defining moment? No, all the definitions were made by Uncle Sam.
So it was a lot of voluntold, sounds like.
Yeah,
Or it's like,
exactly.
you know what it reminds me of? It's like when you date a guy for like 9 years. And then you think, do I really want to marry this person? But then you look back at it and you go, I've spent 9 years, 9 years of this relationship, 9 years of sharing things. Why not? I mean, I've come this far. Let's just go down
That's right.
the deal.
That's right.
You just
Hey,
look back and you go, might as well keep moving forward. No sense in starting over anything new now.
Yep.
That's what he
I
did.
think
He did.
I think most of my life, I don't know whether I should be glad to say it or sad to say it, that has been a convoluted thing of, where I am at the right place at the right time. I mean, I came right out of high school at age 17, joined the Navy and Vietnam was hot at that time, to join the Navy to go on submarines, specifically because my mother wouldn't sign me unless I could do something there where I wasn't going to be backpacking and so then when I was in boot camp, being a good 17-year-old guy, we see these guys come to the base and go to the enlisted man's club, and they're either aviators or divers.
Right.
And so, I pointed to one of those guys in the green outfit and said, that guy, see all the women around him? That guy, that's the guy I want to be. Put me on. And he said, no, kid, you do not want to do that. He's a diver. No, I want to. So I got my wish, and then I cried my way through dive school, and then I had my one and only tour over there, and then I cried enough to put me on submarines. And so it was just one of those things. It's either you're stupid and, because 17, 18 years old, why does the government because you think you're invincible. At
Right.
that age, you think you can do anything, I was like, yeah, I can do this shit, whatever. But yeah, it's just,
There went your
it-
podcast FAA fine. Your FCC, whatever it is, Federal Communications fine. I told Pete that my former business partner's dad was a colonel in the Marine Corps. He was a test pilot for Harriers. He has a
crazy
similar,
man.
I know, good looking man, best looking wife. So what people don't know probably is that Skip's probably married to a Sports Illustrated former model. So it all came true. It all, he
Wow.
didn't, he doesn't even talk. It all came together.
Right.
Yeah,
He
well,
ended up,
and as far as coming together, it's funny, the three of us. My wife, her degree is in exotic animal training and zoo management, and so she's a behaviorist for Fetch Lab. So it's a good match because we both like animals, and
the
I
very
mean,
first time he said that to me, Alex, after I read all of his bio, and he said, my wife has a PhD in exotic. And you know what I thought? I told him, I said, man, I thought you were going to be funny and say something else. But when he said exotic animals, I was like, oh, thank God, because I thought he was going to mess with me and say, she has a PhD in exotic dancing. And I was going to go, you got kidding. But because I thought only a military guy like that would make that joke. But it
no,
turned out that she's not just a hack rack, that's for sure.
no. She's she's the mainstay of us working with the rhinos and the elephants in South Africa. So, if I need to know something about animals, I'm stupid. I go to her and ask her. She tells
Well,
me what
smart
to
move,
do.
because she's the one that's going to tell you whether they're going to eat you or not.
Oh, yeah. Well, yeah. And, she does all the training, of our own dogs and everything. She's out there with the border collies herding and, dock diving, and God only knows what the hell else is going on there, and I just trying to keep out of her way.
I love it. I love it. I mean, well, that what an extreme, how well that complements everything you do. I mean, that is incredible. I'm sure that, over the years too, for how long you all have known each other, that's probably been, I feel like, that would be
Look
interesting
what it
because,
did.
well, I was going to
His
say,
hair.
she's very supportive and knows what we do with the dogs, and like she loves it and all that good stuff. But like, there's a line to where she will gladly be like, right, enough for the day. That's it. No more. It's like, there's a clear line in the sand when it's like, we've been talking about dogs for 4 hours. Enough. So
Right.
it's interesting to see it intertwined in your career and your day job, though. That's really cool. I love it.
Right.
I'm
It is a
just
good
very
story.
I'm just very pleased that animal audiology is starting to take off, and that Fetch Lab is, doing things. We're all over the country now, and people graduating with their certificate, and, meeting people like you guys and Allison, helping her out or whatever like that. Those are the things that I like. Those are the things that make me go.
Well,
I mean, as far as anything else goes, from a soul point of view, if you will, the last duty station I was at was the think tank, Naval Underwater Systems Center, and they decided that they wanted me to continue doing research with dolphins, but they didn't want to send me out to California where the Navy dolphins are. So they traded me to Mystic Marine Life Aquarium as a trainer in the Marine Theater. And I'll tell you, when you're working with dolphins and sea lions, every day's a new day, and you get tacked onto those animals, and it's just like, really? No shit, And then those were halcyon days for sure.
Absolutely.
Well,
And
I
yeah.
told my management team after this whole thing started with the AI Center, I would say the first week of February, I think I've read 350 papers. I know every major scientist. I've read every article. I've cataloged them. I've studied everything having to do with animals and AI and people and AI. And I miss just being around. I never thought I'd say this. I just want to go hang out in the kennels. That's all I want to do is just go. I don't want to go sit in court another day. I don't want to go look. I just want to go sit with the dogs and the cats. I never thought I'd say that because I did it for so
Yeah.
long but now I'm just like, oh my gosh.
Hey, the fun just never ends,
But I'll tell you what, that I'm definitely, not that I needed something else to be worried about, but I'm worried. I am. I'm worried about it.
Yeah.
I'm a little bit worried about it.
I think Dr. Skip, like you said too, going back to, how being more involved in the community with like Fetch Lab and how it's audiology and it's getting bigger and bigger, and it does make you, it really gets you out of bed and to work where when your work is making a difference, it's changing how people tackle their current events, their current training, how they treat the dog. It's literally changing it in a moment's notice, based off the information you share with the world. So, and that, Allison, going back to what we're talking about, the LEO departments, earlier, it's nothing that, whether it's audiology, because in my mind, I want to treat audiology like a TCCC, or how handlers treat heat injury cases and heat injury knowledge, and how excited, and they're like, "Oh, we got to know that stuff because we experience it. We got to know how to treat, you know, uh, open wounds. We got to know how to treat lacerations and put a tourniquet and all this." And they're really gung ho about it. Well, let's get as gung ho about audiology, because that could be causing issues every single day, and it's just invisible. So it's not a gunshot wound, it's not a broken leg, but it's just as important to preserve their career. So I really hope, again, going back to military search and rescue, being on helicopters, being on the range, whatever, it's taken as seriously as anything else. That's where I dream of it being, over the next 2, 3, 4 years, as this gets more and more traction. And I'm not expecting or asking anybody to change what they do on mission, because let's be honest, again, Allison, like going back to what the gentleman said, being on the range, like, okay, I know, so, well, the dog has to hear us when we're shooting. Brother, I promise you, even putting a caps on and the dog being right next to your pocket, he's going to hear. I can plug my ears with, proper NRR, legal hearing protection on a range or whatever, and I can still hear you when you're a foot away from me talking. It's not like I go in this vacuum. It's not like the dog's going to go in this vacuum and be shut off from all sound. Like, yeah, that'd be cool, but it's not how that works. So it's literally just mitigating the risk based off what Dr. Skip and his team put together for that system, because it's the only one, again, on the market with the NRR and the proper scientific backing. So again, it's not, and you have to go back and think, again, these guys, Dr. Skip, we had this sidebar prior to this episode today. A lot of these systems on the market currently, it's more weight on the dog. It's snag hazards. It's potentially causing the heat injury risk to go up. And so, am I expecting or thinking that anybody's going to change their TTPs on mission? No. Like, I understand if the snoot is on or a helmet is on, whatever, on mission, and it's a snag hazard that could potentially put the dog in more harm's way than if it were up. So yeah, I'm going to risk some gunfire for that. It's not a black and white issue. It's a very gray, but instead, that when the opportunity presents itself to have protection, I'm going to have it. If I'm training or in a situation to where it's benefiting the dog more so in preserving its career, and it's not going to cause any potential issues, then heck yeah, I'm going to put that on my dog. So I don't want people to see this in the light of black and white, because it's not. It's a gray area. Training versus going out on the street are different. Of course, you're going to have those considerations, but, overall, Allison, whether it's your presentation where you're going through with the AI data center, or Dr. Skip's work is presented over, a long career, this should get, once you hear this, there's no more reason, and you have no ability to say, well, I didn't know. No, you just didn't care. So let's be honest with ourselves, and handlers should be honest with themselves and say, well, now that I have this knowledge, I need to make a change. Right.
Right. But think about, if you think about all these people that live right now that we're seeing on the news every night, they can't choose. So now if they have pets, and then if they learn about this, they're going to have to figure something out, because there's a real issue. I mean, I've visited some of them, and I don't know if y'all have, but I have. I could not believe what I heard. I couldn't believe what I heard. I had to go for myself to because I'm just that type of person. I wanted to make sure it wasn't some conspiracy. So I flew to some of them, and I went to some of the sites, and I just stood there, and I saw all these houses and people's pets in the backyard and things like that. If I had to live in that 24/7, I do not know what I would do. It is a constant. I really don't, y'all. If you haven't been to Dewajniak, Michigan, or South Haven, Mississippi, or some of the places that are famous right now, I don't know what I would do. I think I would lose much less if I was a dog.
Right.
But if I was a person, I really do think this whole issue that you guys are talking about is just going to become more and more of an issue because the owners that are living near these centers are going to probably notice things with their pets and they're not going to understand what's going on. And
Right.
they're going to need to know this information so that they can at least know how to try to prevent some of this if it's going to, because think about it, they may be putting their dog outside for the day and not even realizing it's never occurring to them what's going on
Yes.
with that. It didn't
Right.
occur to me until about a month ago. So
Again, well, like you mentioned in, I think it was episode 1, Allison, a year, 2, 3, 4, 5 from now, I can see this, in a perfect world. I can see posters up in veterinary offices about audiology, about precautions to take. I could see 2 big posters of everything Dr. Skip can outline, fitting on a 20-inch by 10-inch poster of, hey, here's considerations. If you live in this area, here's how to protect your. There's just nothing like that right now. Nobody's considering that and factoring it. So I want to see posters about this in vet offices. I want to see military working dog vets or trainers or kennel masters have this in a TCCC or in a just an overall health and well-being class for their handlers, and pass this knowledge, because it is a topic that can end a dog's career 100%. So it needs to be taken as serious as anything else.
Yeah.
And I really hope it does bring to light some change, not just for, again, like Dr. Skip and I's realm of military working dogs and canines, but civilian pets as a whole. But
yeah,
I guess on that note, Allison, any other comments, questions for Dr. Skip? I'm sure this will not be the last time the 3 of us get together. So I'm
No.
sure
Yeah.
it won't. I
No.
bet.
we shape or form.
One thing I can tell you guys, because they're mentioning not only military dogs but pets. The first, other than my master's thesis and my PhD dissertation, the first published paper that I did was from a gal that contacted me. I did it for her because she wanted to know about air dryers. When a little dog goes to get groomed and they got the hair
yeah.
dryers they do, how are they audiologically safe? I'm not going to tell you the answer. You can have to.
Oh, I mean, I saw your
Oh yeah,
2012.
actually they put out a pretty good amount of noise, so that if you're the person operating the dryer and the dog and you're drying and it's near the dog's ear, you got to be
Right.
really conscious of that. Something as simple as a hair dryer, doesn't have anything to do with military dogs,
Sure.
but people are doing it all the time.
Well, not everybody's in the military, y'all. I hate to tell you that. Most of us are just out here walking around. Most of us are just out here walking around letting y'all protect us. That's all I got to say. So
And
we're the ones you're going to have to talk.
And what Alex was saying, when we go to places and we, to look over a hearing conservation program at some company, whether it's Detroit or whatever, and then part of that is the people that are working in 90 decibels or more have to, by law, have to
Right.
wear hearing protection, which is bought by the company, and then we have to fit them. And I can walk out on the floor where the guys are working and find at least one person that is not wearing their hearing protection, and the rest of them, because usually you give them the inserts, okay, and so the rest of them, they half-heartedly put it in, so the thing is the plug's not doing anything.
So they don't like it. It's just they don't like to have it in.
No, but you ought to hear the things. You ought to hear the thing that the number one thing that we hear from people in those situations is, I don't want to wear that because I can't hear my machine and I can't hear my boss if he talks to me. And I'm like, no, you're going to hear, if somebody talks to you, that's not going to get mitigated by the plug. You're going to hear them just fine,
Right.
and
Right.
short of an explosion, anything that happens that, the machine starts making a different, you're going to hear that. What you're not going to hear is you're getting rid of all the extraneous noise that is going to cause a problem across the board. So, yeah, but nobody wants to wear them. And, that's another thing I say about putting earplugs in the dog's ear. You put a plug in there and the ear is moist and it's making wax. And now you got bacteria in there. And then guess what? you're in for, take a
That's
trip to the vet because you're going to be putting Panalog or something in there. So yeah, just things to think about. There's never, it's always complicated. There's never any simple answer.
No, it's never black and white. It's always gray areas. But again, science is science, knowledge is knowledge, and you can take it and apply it to your situation. And if people still have questions, they can reach out. I mean,
Sure.
that's as much as you can do. Is you take everything, you know what you know, use it as ammo, and hopefully somewhere in there there's an answer.
Well,
Yep.
we'll find it. All
So,
right. Well, y'all have, y'all
You guys are
enjoy
the
the-
ones that you guys are the spearhead, people like Allison and you, Alex, that, you guys are raining down this stuff and you're right.
Yeah, right.
You're right on time, if not a little
Yeah.
bit late, but
I'm old.
but
Alice is young.
keep it up. Yeah. Well, I was born before Moses, so give me a break.
I was born with God. I was born right there. I created Moses. So I got you. I'm telling you. I may look decent. I mean, I have a fairly good colorist, but I'm telling you, I get my Social Security in 6 months.
well, God, Alice and Dr. Skip, thank you all so much. And like I said, this won't be the last time we all get together. I guarantee it. So there'll be a lot more.
Make
to
sure
come.
and send me the link. Make sure and send me all the links so I can share
Yes.
all of it.
Yeah, me
Yes.
too. Because I'm getting asked by people, how do I listen to it? So
I know.
Yeah. On Spotify, YouTube, we're still working on getting episode 1 up on YouTube currently, just from the video situation we had. So Spotify and YouTube, and eventually, because I know some people, they don't like to watch YouTube, but they still want to listen. I'm going to work on getting these 3 episodes on, I think it's called Sprout. It's a free platform to where they don't have to have a subscription. So I'm going to do my best to get those on a free platform so they don't have to worry about paying for a monthly subscription to listen to this or anything. But yeah. So
Don't forget to send them your slides and so people can see those slides.
yes, we'll work, Dr. Skip. We'll work on getting a public link or some best way to share that safely with the general public so they can reference the slides, they can take notes, all those good stuff. We want as much knowledge up there as possible. So whether that's a Google Drive link, what have you, we'll work on getting that to the general public in the next week or so, Dr. Skip and I, and we'll go from there. And again, if you're listening to this 6 months from now, it doesn't matter. Email, comment, DM, whatever, get your concerns, get your question. We'll tackle it at that point. Because again, everything, it's always changing. Everybody's situation's gray area. So we want to make sure you have the ammo and the answers for your situation. So,
All right.
absolutely.
thank you all so
Bye.
much. See you next time.
Yeah. All right. See you later.
Bye-bye.
Bye.